Thanks for joining us on In Focus tonight. We start with this story. It's a segment of the healthcare industry that's growing, but many people still don't know about it. Known under a variety of names, from private physicians to concierge medicine to retainer practices. Some say it's a better way to handle primary care. In Focus, investigator Trang Do explains whether paying a fee for enhanced health care is really worth it.
Well, Kelly, concierge medicine sounds pricey, but proponents of the model say it's not just for the rich. Still, other doctors argue it's taking good doctors away from serving those most in need.
Hey guys, hey Marsh, how you doing?
Marsha Thompson loves her doctor, but suffers from white coat syndrome. Her blood pressure jumps whenever she visits a medical office.
Everything's good? Yeah, everything's good, everything's fine.
She says her anxiety has gotten much better since her doctor transitioned to a membership model through MD-VIP, a nationwide network of private physicians.
I've just seen a more relaxed office, period. And it makes the patient more relaxed, I think.
Anything new going on with you today?
Her doctor, Louis Malino, made the switch from a traditional practice in 2008.
Back then, I had over 3,000 patients, would see in the neighborhood of 25 to 30 patients a day, would be able to spend maybe 15 minutes with every patient, longer for annual exams, of course. Longer if somebody needed it.
Now, the Baltimore County practice he operates with his father is capped at 600 patients who pay an annual fee. In exchange, they get a comprehensive wellness exam with additional testing, 24/7 access to their doctor, and quick referrals to specialists and elite medical centers across the country. Dr. Malino says the focus is on personalized preventative care.
We did good medicine before we transitioned, but I think what every patient really needs is time. You know, you do a better job with everything if you have more time.
Every concierge practice is different. Some, like Dr. Malino, also accept insurance, while others do not. Fees range anywhere from several hundred to several $1,000s a year. On average, it works out to about a latte a day.
I think for anyone who eats out, this is something that's doable. It's just for the patient who prioritizes their health over other choices.
The American Academy of Private Physicians estimates there are 6,500 private physicians nationwide. The first known concierge practices in the U.S. opened in Florida and Seattle, Washington in 1996. Dr. Richard Colgan is a family physician and professor at the University of Maryland School of Medicine. He says the added cost still puts it out of range for many families and has kept these types of practices from more rapid expansion.
I think that it's small because it's expensive, and there's very few people who can afford to pay that kind of premium.
The medical center's Department of Family and Community Medicine sees 50,000 patients a year. Dr. Colgan says despite the high volume, patients are receiving great care.
We definitely provide, in our opinion, and I think in the opinion of those who we've surveyed, top-notch care for all of our patients, be they with a lot of financial resources and those who have less.
You guys walking?
Yeah, we started back.
Thompson says she and her husband do make sacrifices to cover the additional cost of seeing an MD VIP physician. She views it as an investment in her health and credits Dr. Malino with helping her live a healthier lifestyle and managing her chronic health issues.
It just pays off, you know, in the end. And we just kind of fit it into a budget, you know. I don't think there's anything more important than your health.
MD-VIP shared several published studies with me, including one showing that their patients saw significant reductions in hospitalizations and readmissions compared to patients not seeing an MD-VIP doctor. But the authors did note that people who would pay an annual fee for additional care are more likely to have an interest in health and wellness and listen to their doctor's recommendations more closely.
All right, thanks a lot for that, Chang.